So we know with methadone, the equal analgesic dosing, it varies between patients and within the same patient because the metabolism of that can change over time. And the longer you're on methadone, the longer the duration of action. That's why we can give people methadone once a day, right? But that's problematic in initiation and titration. And we talked a little bit at dinner last night that methadone was another product that they think really should go to the pain service because it is more problematic to dose. The respiratory depression time is different than the pain effectiveness time. And it's, a lot of those ones that are really complex metabolism through the liver are problematic. And even patients who are tolerant to opioids and are on methadone long term can get respiratory depression. We had a very interesting case in my other life in the private sector. Patients would come in on Friday night with abdominal pain, ow, 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 and so they would get admitted to the hospital and you'd ask them what dose of methadone. Oh, 80, I'm on 80. But the clinic is closed. So how do you know? They were probably on 20. So this is how we got our more serious methadone monitoring. So we gave him 80, and he was like really fine. But his respirations were low, so the nurse did her due diligence, and he was, a little bit lower respiration, but he was okay. So we gave him 1 milligram of Narcan. So he went from comfortable with low respirations to drug withdrawal. So after that, we started a registry of our patients that were on methadone and the clinic names and everything. And we totally looked at methadone in a different way. The Friday night ones, because they know you can't call the clinic, et cetera, et cetera. And if they've lied to us one time, this is the hospital, it's been years since I worked there, but if they lied once, we're never getting methadone from us ever. So we had to get really strict with the methadone. But it tells you that even patients with drug addiction can have respiratory depression.